The Pandemic to Prosperity South project highlights the social and economic changes in the American South following the outbreak of COVID-19. The most recent report painted a pretty grim picture of Louisiana's capacity to provide quality lives for its residents. Allison Plyer, the chief demographer at the data center, helps interpret those statistics. Hey, Allison, thank you so much for joining us. And I'll just start off with the question. So, you work for the data center, and part of that job is running these studies where you really analyze how Louisiana and really the entire South is recuperating after COVID-19. And you guys recently just put out a new study, and that's Pandemic to Prosperity, and it focuses on the South. Can you tell me a little bit about some of those results?
Yeah, sure. Well, one of the things that we found is that nationwide, nearly half of Black and Hispanic adults are really struggling to just pay for basic household expenses, and so are about a third of white and Asian adults. And a lot of that is because of the end of stimulus payments and also, inflation, which has really hit people hard. So we looked at Louisiana, and about 20%, that's 1 in 5 Louisianans, reported that their families went hungry in June of this year.
All of that is directly tied to those stimulus payments
And inflation,
and
right?
inflation.
That's right. So inflation, has ebbed a bit lately, but that doesn't mean that prices have gone down after very high inflation last year, right? So we're all still really struggling with high prices.
So is Louisiana providing any type of service or any type of program that they can go to where they can help themselves? Because 19 to 20%, I mean, that's a very large number of people.
Yeah, in Louisiana and elsewhere in the country, food banks have been, a really critical lifeline, but they've been stretched, especially as grocery prices have gotten so high. One of the things we do know in Louisiana is, we have about more than a third of all adults report symptoms of anxiety and depression. That's new. Before COVID, it was really only about 11%. So those rates have tripled.
Also, basically, we're leading the country whenever it comes to disasters.
We are definitely leading the country when it comes to disasters, and there's lots of disasters happening in other places as well. So that just says a whole lot about some of the struggles that Louisiana is facing.
Do we show any signs of maybe that waning a little bit, or is it becoming more of an issue?
It's actually becoming more of an issue. Drug overdose rates have been continuing to grow. And they were certainly their highest in 2021 and have gone down a little bit in 2022.
Is there anything that I guess people can do to try to relieve some of these effects that are left over from COVID?
The federal government sent a lot of money to states and localities through the American Rescue Plan, and all that's very flexible. And there's also more money that's coming through the Infrastructure Act, and it's really sort of a once in a generation investment in local governments. And those local governments can use that funding to invest in health and well-being of people.
All right, Allison. Well, I really appreciate you taking the time to speak to us. Thank you so much.
You're welcome. Thank you.